Surgeon General Vivek Murthy today warned of a looming mental health crisis with America's youth stemming from the pandemic. Dr. Murthy issued a rare Surgeon General's advisory saying currently mental health challenges in children, adolescents, and young adults are real and widespread. And he cited early data showing emergency room visits for suicide attempts among adolescent girls rose by 51%. It rose by 4% during that same time period for boys. Dr. Murthy said the numbers were trending in the wrong direction before the pandemic, but then they got considerably worse over the last year and a half. Let's bring in Dr. Kwiatkowski, child psychologist at Sutter Health, to talk more about this. And the Surgeon General said today that the reason for this advisory is that it would be a tragedy if we beat back one public health crisis only to allow another to grow in its place, calling this an obligation to act not just medical but moral. I had to think, though, doctor, that is this a growing public health crisis of mental health, or is it already here?
It is here. It has been here for a long time, but the pandemic has really exacerbated the issues that we're seeing. If you think about our children and teenagers, they thrive with social connection, and the pandemic has really led to a lot of isolation and loneliness, social anxiety, worsening depression. Our teenagers' only main way of interacting with each other is on social media platforms, and that comes with a lot of bullying and exclusion. There's not a lot of supervision, so things have really gotten out of control.
You know, I saw a study from 2019 that was quoted that talked about this overall increase in 40% since 2009. So a 10-year span of students feeling that sadness and hopelessness. You add in the quarantine, the pandemic, the everything you just talked about, and it makes me wonder, I mean, even people who have lost loved ones and their caregivers and their parents to COVID, it all just seems so much to wrap our arms around.
It's unprecedented challenges that we haven't seen before. Being a teenager is hard in of itself, but the pandemic has added so many layers to it, not to mention the social injustices and racism and gun violence, climate change. These are all things that our young people care about, and it's been a really hard time for them to navigate, and we've been really trying to encourage people that it's okay to talk about these things. I think that's what the Surgeon General is trying to do, is start decreasing the stigma around these issues and say it's okay to talk about it, it's okay to ask for help.
And I think that is so important. I mean, when I hear young people talking about mental health, they talk about it without, feeling like it's not something they should be admitting. The problem I see from parents is that when they reach out to get help from a psychologist, a therapist, they can't get appointments. Either they're not taking any new appointments or they're saying, okay, we can see you in 6 weeks. And when we identify a problem with our children, 6 weeks is a very long way away.
Yes, it's true. Access has been very limited, which is one of the main issues contributing to the pandemic and this new exacerbation of access issues. One of the things we at Sutter try to do is get creative and take advantage. Being in Silicon Valley, we have access to a lot of new virtual platforms. The one that we use is something called Scout. It's a really innovative virtual tool that we can give to patients while they're waiting to get in for those appointments. And they ask the teenagers questions every day that kind of screen their symptoms, and based on their responses, they get feedback in the form of modules and platforms, and gives them tips to do throughout the day to help cope with their symptoms. And they have a platform for parents, which is really exciting because parents are navigating this too, and they don't always know how to help. So it really gives the parents tools to support their kids.
So if they're not a part of Sutter Health and they're trying to find resources, what do you think step one is? Because it is overwhelming for people. Step one in terms of the conversation at home or the conversation with their doctor.
I think the most important thing for parents to do is to be open and listen. A lot of kids are afraid to share kind of how they're feeling. They're not sure how their parents are going to react. So just opening the door and saying, tell me what's going on. I'm here to listen to you. And, if it's hard to open up to me, let me find a safe adult that you trust, whether that's a therapist or counselor at school or your pediatrician. Let's just get that conversation going, and then we can work on improving access and finding connections.
Yes, acknowledging that it's okay to not be okay. I think I've heard from a lot of people that in this return to society, we keep trying to make it shiny, and sometimes it's not so shiny.
I love all parts of it, the good and the bad, and we're in it together. So supporting each other is important.
Absolutely. All right. Dr. Kwiatkowski, we have to leave it there, but thank you so much for joining us, and insight, and the conversation, of course, will continue.
Thank you so much.
And if you or someone you know needs help, you can call the National Suicide Prevention Lifeline. Trained crisis workers are available to talk 24 hours a day, 7 days a week. The number is there on your screen. It is 1-800-273-TALK.